good afternoon. And all the other regions over here, good afternoon. Awesome. Okay, so there is no greater pick-me-up than Shot at Life, and I say that with pun intended. We are actually going to talk a little bit. I'm really glad that we're following the membership development session, because we're going to talk a little bit about the tools that we can offer you to help you develop and recruit more members, and young members, but more members in general, because I think that that's something that we at the UN Foundation have the sort of skills to do, and we also have been able to learn a lot through the campaigns that we've run so far. The Nothing But Nets campaign, the Girl Up campaign have always been there to be able to support turnkey tools and initiatives for you to take those to your chapters and to be able to engage more members. So similarly, I'm here to talk about Shot at Life. So before I do that, I think I'd like to show you a quick video about the campaign and get you a little bit emotional. So why vaccines? We've done a campaign on malaria bed nets. We've talked about campaigns on women and girls. Why are we focused now on vaccines? Well, vaccines are a very important element of reducing childhood mortality, as you know. They are by far the best public health invention of the last century, many have said. But I think it's also important to note that the UN Foundation has actually been involved in vaccines since its inception. We have been helping with measles, reducing measles mortality. We've actually been involved in the Global Polio Eradication Initiative for a very long time. Through the efforts of the UN Foundation and all of its partners, we have reduced death by measles by 74%, and we recently just immunized our 1 billionth child against measles. So there's a lot of reasons why vaccines made sense at this time. And I'll talk a little bit about the diseases that we're supporting with Shot at Life and why this time is also important in the eradication of those particular vaccine preventable diseases. Now, I will also say, though, another reason why this came to us is the Gates Foundation sort of stood up and took notice. They took a look at Nothing But Nets and Girl Up, and they saw these campaigns and what chapters, UNA chapters and champions were doing around the country and advocating for these important issues. And they said, hey, we can do this around vaccines. And we sort of thought about this for a long time, and we went out, we did some market research, and this is where my background really comes into play. And we said, okay, let's figure out if this is something that would resonate with Americans. If we walked up to a group of American moms or American grandparents and we talked about global vaccines, would it make sense? Would the current economic climate affect how people talk about these issues, specifically helping children in developing countries? Well, what about our own? How about mothers who are giving vaccines to their children but are vaccine hesitant in some way? So these were the kind of questions that we had to answer, and it took us over a year to really come out with this campaign. It was launched in April during World Immunization Week, so it's just a couple of months in its creation. And what's really neat about it is we have 120,000 supporters in the US already. It's very, very exciting. We really haven't even been born yet, and we've raised about $80,000. I think it's just the next big thing, and I guess I can say that because I'm the director, but I think I can also say that because I think we're onto something here. Sure. Our supporter base is 120,000, and we've raised about $80,000. $80,000. Thank you. So what are we doing? Well, we're here to build a movement of Americans because we want to decrease the 1.5 million vaccine-preventable childhood deaths that occur every year in developing countries. Just so you know, this number translates to one child dying every 20 seconds. These are preventable deaths, and I really want to stress that because there are a lot of causes out there that don't have a cure. A lot of the times we talk about issues that are complex, but a vaccine is simple. It really is. It's out there, the medicines exist, it's a question of access. We have to increase access so that children can receive these vaccines. Now, our job at Shot at Life is to educate, empower, and connect Americans to champion these vaccines by learning, advocating, and donating. And I'm gonna talk about these three main goals of learning, advocating, and donating, and why it's important, we think, that UNA chapters embrace this campaign. I've talked a little bit about the power of vaccines as a public health success story in the last century, but I would like to say that they're safe and they are cost effective, and that's a message that really works, especially when we're contacting our congressmen. We know that they are one of the best tools we have to save and improve the lives of children in developing countries. They're especially important in developing countries because they level the playing field. They are the great equalizers. They are there for the most vulnerable children who otherwise are unlikely to make it to a doctor or a hospital, and often once a child in a hard-to-reach remote area gets sick, it is too late. We've made great progress reducing childhood mortality through vaccines, and vaccines currently avert 2.5 million deaths every year. So let me tell you a little bit about the diseases that we're hoping to support through Shot at Life and through working with our partner organizations, and I'll get to that in a little bit too. We believe that the 4 diseases that Shot at Life is actually going to focus on in this very first year are polio, measles, pneumococcal disease, and rotavirus. And I'm going to talk a little bit about why we chose these diseases. Polio and measles, it's a little bit of an easier story because the UN Foundation has been involved in helping UN agencies with these 2 diseases of polio and measles for a while now. But polio, my God, what a story. How many of you here know about the great story of polio? 99% reduction. We are so close. We are 1% away. And you know, this is a disease that's really close to a lot of people's hearts. And when we go out and we talk about Shot at Life, this is the one that I think really gets to people. And there's a deep understanding of why it's important to make sure that polio does not remain a threat. Polio is spread from person-to-person contact, and it's highly infectious, as you all know, especially easy to transmit in high-risk areas with poor water, lack of sanitation, hygiene control issues. So most people infected with polio have no symptoms, and the disease can often go unrecognized. However, in approximately 10% of cases, symptoms can escalate, leading to irreversible paralysis or quadriplegia. Now, I was at a very interesting polio partner meeting the other day, and the Gates Foundation was there, and Rotary International was there, and all of these people are making such great strides in polio eradication. And they were talking about how narrow the focus is now on polio. It's endemic in 3 countries in the world, in Nigeria, Pakistan, and Afghanistan. Most of the cases in Afghanistan have actually come from Pakistan. So there's really kind of a narrow region between those 2 countries that we have to focus on. And then northern Nigeria. And what was really interesting when we were tackling this problem is we've now begun to look at it at a very regional, village, district level. We're looking at how many social mobilizers do we need to make this work? What is the birth cohort in these areas? What does the nomadic population look like? Because if we don't get to that last child, we are not going to eradicate this disease. So there's a lot of effort and work being put in through the wonderful partners of the Global Polio Eradication Initiative to make sure that this disease can be eradicated. So I do want to point out this little girl. I think she's a great story for polio. Her name is Rushkar Khatun. She's from northern India, UP or Bihar, I'm not quite sure which province. And she is the last case of polio in India. That's pretty exciting. We're in a situation now where India has been polio-free for 1 whole year. So this means we can just talk about Afghanistan, Pakistan, and Nigeria, but more importantly, we can say we did this in India. And 2 years ago in India, India had more polio cases than these countries combined. So clearly the solutions exist. We know what to do. The WHO, UNICEF, and others are working very, very hard to make sure that there are no more transmissions. That's really our goal, 0 cases. Measles. One of the reasons measles is such an important disease is not very long ago, it was the largest killer of children in developing countries. So now I can say that that's not the case. Death due to measles has been reduced by 74%. However, and a lot of it is because of the efforts of the Measles and Rubella Initiative. However, it should be noted that measles is also one of those diseases that is so infectious that I'm standing here and South Central, you're sitting right over there. If I have measles, so do you. It's that infectious. There was recently a case in the US where somebody walked through the Super Bowl. Did you guys hear about this? Somebody walked through a very crowded area in the Super Bowl who had measles, and there was a measles case that came out of that. You know, what's fascinating about this disease more than anything is that the vaccination against measles in developing countries began in the mid-1970s. And both through measles and polio, what we're seeing is that they're sort of gateway vaccines, because if we create the infrastructure to get these vaccines to children, we're now noticing that it can be used for other health and routine immunizations as well. So for example, we're able to give vitamin A supplements to those children when they're coming to receive their vaccines. The other story I like to tell with measles is the Shot at Life team was in Mozambique last year, and we were very lucky to see a measles campaign, and my colleagues who were on the trip actually said that they talked to mothers and who were coming to receive the measles vaccine, and they were walking in the hot sun, and one of the mothers said to them that she walked 15 miles to get to that measles vaccine site. And when we asked her, well, why did you walk so far? She said she's already lost 2 kids to measles and she's not losing another. And this is a story I tell a lot of mothers as I travel around the country, because it really, I think at that point, vaccine hesitant parents or people who have questions about vaccine safety, they're just quiet after I say that story, because it really is a question of access. These mothers want these vaccines and they're walking great distances to get to them. Pneumococcal disease. The Gavi Alliance, how many of you are familiar with the Gavi Alliance? This is the Global Alliance for Vaccines and Immunizations. And the Gavi Alliance has undertaken the very great task of introducing pneumococcal vaccine and rotavirus vaccine, two relatively new vaccines to developing countries. They are going to roll this out to 40 countries by 2015. The first country to receive this vaccine was Sudan, and we're actually very, very excited because Shot at Life is very much part of that progress. We're the ones that we're hoping will help drive the introduction of these vaccines to countries. Pneumonia is the currently the leading killer of children in developing countries. And pneumococcal disease is a bacterial disease that can actually cause both meningitis and pneumonia. The most common symptoms of a pneumonia accounts for 18% of child deaths in developing countries, making it the #1 cause of death worldwide. In 2010, the Gavi Alliance, which is actually an innovative financing mechanism, Gavi has worked for a very long time to work with the WHO and UNICEF to deliver the vaccines, but also work with the ministers of health, ministers of finance in countries, with donor countries. They also work with pharmaceuticals to reduce the price of the vaccines. It's a wonderful marriage of public-private partnership and a great feat to make sure that these vaccines are able to get to those in need. So the idea behind pneumococcal is the current program, which is to introduce it to more than 40 countries by 2015, and our goal there, once at full capacity, is that the program will save 650,000 lives every year. For rotavirus is actually, the rotavirus vaccine is a vaccine that helps prevent death from diarrheal disease, and I'm going to show you a quick video on this and hope this time that the audio will be a little bit better, but I will also do the little trick of holding the mic up.
Hace 3 años nosotros teníamos
3 years ago, we had high rates of diarrhea and severe dehydration.
teníamos tantos casos de diarrea.
We had so many cases that we'd have 2 babies sharing one bed.
Yo soy doctor,
I'm a doctor,
pero también soy.
but I'm also a father,
Era difícil observar.
and it was hard to lose so many of our kids to rotavirus.
Era como sentirse sin poder hacer
We felt helpless because so many of our kids would come here, only to die.
Aunque nosotros hiciéramos,
And even though we would do everything we could to treat them, for every child we healed, 2 new ones would appear. For everyone that left, 3 new ones came.
Mi hija se llama Scarlett Sarai.
My daughter's name is Scarlett Sarai Alvarez.
Tengo 4 hijos.
I have 4 kids, and she is the youngest. She's my princess. We are here because she's sick. She's vomiting and has diarrhea.
Bueno, yo como padre trabajo.
As a dad, I work to protect my kids, but sometimes I worry.
Mi amor, mira, le damos unas gotitas a mi niño, ¿eh? Sí, a mí me encanta.
al llegar a esta vacuna a Pantasma,
When this vaccine arrived in Pantasma, the number of cases of diarrhea dropped.
actualmente
Today, we don't have a single child admitted into our rotavirus ward.
Hasta hoy estamos aquí.
We are going home today.
Pues si no estaba con
If she hadn't been vaccinated, she'd be a lot worse.
no podemos evitar
We may not be able to prevent kids from getting diarrhea,
pero sí
but we are able to prevent them from dying from it. And that is something we couldn't say before.
Para mi hija, quiero todo.
For my daughter, I want everything. I want her to grow strong and healthy.
Tiene 2 años y espero que
She's 2 years old, and I hope she grows to be a strong and determined woman, a superstar. Right, my love?
you. So vaccines are cost effective. We know this. We know that for $20, you can immunize a child against these 4 diseases: pneumonia, diarrhea, polio, and measles. We often try to break that number down, especially as we go out and we talk to people about fundraising for this cause. $1, for example, can provide a measles vaccine. For less than $1, you can actually provide a polio vaccine. These are very, very cheap solutions, and they basically ensure a life. So how are we talking about this campaign? When we go out there, it's not very easy to talk about poop. It's also not very easy to talk about childhood death. It's sad. And you see a lot of campaigns out there with pictures of children that are struggling in hospitals and clinics, and all of that is true, and that's why we do the work we do and why many of you are advocates for these important causes. But the truth is that there has to be something brighter on the other side. And I think as a mom, and as we go out there and talk to parents and grandparents, our big hope is to help people understand that the vaccine is just the beginning. And what we're really hoping to celebrate is milestones. Some of you are familiar with the 5th birthday campaign and what they're trying to do, what USAID is trying to do with that campaign. And I really like the premise of it, because the majority of these childhood deaths do happen before the age of 5. And that's why the 5th birthday is such an important milestone. And often in the case of vaccines, the 1st birthday is a really big milestone. So we focus on the moments. We focus on giving children a shot at good grades, a shot at MVP, a shot at wrestling with his dad, a shot at celebrating his mom's birthday or celebrating his 1st birthday. And that seems to be, for us, the language that we think really carries this message to Americans who maybe have not had the privilege of visiting some of these countries and seeing firsthand what we've been able to see. So another way we talk about this is really focus on this idea that 1.5 million children at the end of the day is a lot, and one of the ways to imagine that is an idea of a kindergarten class, or the number of kids that actually enter kindergarten every year in the US. And if you take those children and divide it in half, that's the number of children that are dying every year. This has been something that we find is effective as we go and we talk to schools or teachers or PTA associations, and it's been one way that we're able to really bring this message into an American context. So what's our plan for success? I think there was an African proverb, and I'm sure many of you in this room have heard about, if you want to go fast, go alone. But if you want to go far, bring someone with you. And we can't do this alone. We're very familiar with that. So we have an amazing group of partners that I'd like to just say every day I'm amazed at the dedication and effort they put into this issue of global vaccines. Real Simple magazine, for those of you who read that magazine, in the June issue, Shot at Life is featured. They talk about an amazing Rotarian advocate for polio, and then talk about how Shot at Life is really the way that others can get involved in this issue. We also have the great privilege of working with the American Academy of Pediatrics. And what a great group to have behind you, because they know every day the importance of vaccines. They administer in their offices, and they're happy to talk about the global connections and how really germs don't need a passport. So vaccinating children in other countries is just as important as vaccinating them here. We also are able to work with community or club members such as the Lions International, Rotary International. We work with MoCA Moms, which are chapter-based organizations, and we work with UNAs as well on the ground. And I think that the money that we raise ultimately is going to support our implementing partners, the World Health Organization, UNICEF, and Gavi, to administer these diseases. But the goal for the program is really to build a movement of Americans who care. So while fundraising is equally as important as all the other goals, we really hope that we'll develop a good base of advocates. And we're hoping these are people who will call their congressman up and who will host letter writing parties to make sure that the US government continues its support for vaccines. So how do you get involved? The best person to talk about this is Yasser, who I have the great privilege of introducing soon. But I will say that getting involved in Shot at Life is pretty easy. What we have, and you'll see this on the table here, is a toolkit. And inside this toolkit is everything you possibly could need, including an activity guide that tells you everything you need to know about childhood vaccines, how to host a party if that's what you're interested in doing. I love the idea from Boston earlier of a tap party. Well, I don't need to go that much further to talk about all the puns on shot that you can do with that as well. It's really an exciting movement because we've given everyone the opportunity to take their creativity and run with it, and as well as get your kids involved, get your grandkids involved, get your schools involved, get your communities involved, and I think that we've hopefully got everything in there to help you. So there are 5 simple sort of ways that you can advocate for Shot at Life. Visiting your congressman is one of them, hosting an event in your community, wearing your Shot at Life t-shirt. We provide t-shirts in our toolkits as well, setting up materials in your community, as well as talk about global vaccines at your next book club or UNA meeting. We think that all of those are valuable for the Shot at Life campaign. There have been many events around the country. We've actually had 90 to 100 champion events happen across the country already, and as I said, we're very new. And as you can see, we're pretty much represented everywhere. So we're happy to connect you with local champions who we already have. We did something a little different with Shot at Life. We brought 50 champions, and these are women and men who applied to be part of the program and to be our sort of initial base of supporters to DC in January. And we spent two and a half days with them, and we did everything from advocacy training to vaccine training to helping them understand the program. We co-created materials with them, and we sort of said, okay, now this is yours, make it your own. And these champions sort of went off and developed their own communities around Shot at Life. And so what we have is a group of supporters who are very passionate but also very much trained on the issues, and that's why we're able to get this kind of footprint. The Shot at Life toolkit, as I mentioned before, my colleague Caroline Barrett is here, and she has a couple of samples. If any of you are just so excited to take this and run with it, she's right here with them, and she's happy to send them to you afterwards, or the digital version of the toolkit is available if you don't think that you would need everything in it. And this is where you can find the digital version of that toolkit, is on our website under Tools, shotatlife.org, Tools. So I guess I could ask you guys how you're going to stand up for childhood, or I could tell you that in some ways you already are, and I want to thank you for that and for all of the support in helping us gear up. Starting these campaigns and going out with them is not easy, but I think what we're learning is that with support from folks like you and from chapters, we really feel like we have leaders already out there on the ground. It's my great pleasure now to introduce Yasser Vassif from the UNA Iowa chapter. He's the executive director there. And Iowa's taken this Shot at Life thing pretty seriously. They've taken it out there, and they're doing some pretty neat stuff, and I thought it'd be nice for Yasser to step up and talk to us about his leadership on this campaign. Thank you.
Can everyone hear me? Great. Thank you, Debbie. So I was part of this conference you mentioned, the beginning of the year. And there were 50 people there. I actually have to be just one of 3 men at this conference. And I quickly realized you don't have to be a mom or you don't have to be a woman to care about saving children's lives. And right after the conference, I talked to my dad, who happens to be an MD. And I was born in Iran during the Iran-Iraq War in a lower class neighborhood in East Tehran. And I asked my father, if children in my neighborhood were receiving their vaccines, and because of some of the conditions of war, not everyone in my neighborhood was. My dad happened to be a med student at the time, so I was lucky enough to receive my vaccines. But this is an issue that goes beyond just developing countries, and that's what I'm really attracted to this campaign. And one of the biggest things I noticed at this conference was this is a very UNA-friendly campaign. It continues our tradition of advocating for human rights and global health campaigns. And the marketing and the materials are just very, very impressive. And it's something we've been able to use to recruit people in Iowa. And one of the cool things I noticed is, this conference was primarily mom bloggers. And they were tweeting, they were blogging during this conference. And that's, I don't know about your chapter, but that's a demographic we haven't tapped into at Iowa is young mothers. And I see a lot of rapport being built and a lot of potential for membership from this demographic moving forward. So in Iowa, we had to come up with an approach. It's a brand new campaign. I don't know about you, but we already have a lot of campaigns on our shelf. So we have to use our time wisely and efficiently. So we have to balance our short-term and long-term objectives. And with any new campaign, in our view, it's mostly about awareness early on and balancing the different facets of this campaign, like fundraising and advocacy and so forth. And finding community partners, which is always helpful. And building a team internally that can focus on Shot at Life and our other campaigns moving forward. And I'm going to touch on each of these very quickly. As I mentioned, we first set out to educate people about the issue. And congressional lobbying is also a big part of this campaign. And that's something we found easy to do with we have 3 UNA student orgs at different campuses across Iowa. And at each meeting, we had them sign the cards. And we've sought other groups like UNICEF student orgs across Iowa. And UNICEF student orgs, there's over 100 of them across the country. So I really encourage you to see if there's one in your area to partner with them as well. In the long term, we're thinking community fundraisers. And after we've established interest in this campaign, bigger and bigger events. As Debbie alluded to, there are some really cool concepts with this campaign that really bring in different audiences. We came up with things like a free throw shot contest, a basketball contest. In Iowa City, for example, our local Best Buy is donating a video game console. We're going to have students for $5 join a free throw shot contest to win potentially an Xbox 360. And the $5 is enough for a polio and measles vaccination. We're very active with the UNICEF TAP project. I don't know if any other chapters are involved with that clean water campaign. One of the things they do is happy hour, and we thought about just applying the same thing during happy hour at some of the bars we've already been involved with. And this is a great venue, again, to bring in young professionals, as Boston UNA mentioned. Bringing in these folks, educating them, and having a networking session, but also with proceeds going to Shot at Life. Something that might attract chapters who don't have their foot on campus is the dinner parties. One of the things I know is true is that everyone knows that one person or that one family that likes to host dinners. My mom is one of them. And if Albuquerque UNA is here, we should talk about hosting a Shot at Life party in Albuquerque. But we tried one in Iowa City, and it was a great success. This one was with a particular student who loved throwing dinner parties at her house, and we gave it a shot, and I'll touch on that in a second. And finally, at the conference, I noticed we were taking pictures of people holding up these boards that said, "I want to give a child a shot at," and you filled in the blank. And you could be creative, you can say whatever you wanted, and it's just capturing the essence of what it was like to be a child and what we hold near and dear to ourselves that we would think everyone should have the opportunity to have. And we're using this concept and trying to make something bigger, and I'll get into that here as well. So here was our dinner party. We had a spread of desserts. These were food shots, we called them. We had some Persian items as well. And this was a student party, so we had a donation jar. We wanted to know our audience. We weren't going to outright ask students for money. So what we ended up raising was a little over $100, which I don't know if you've tried to ask a student for a membership or anything along those lines. It's tough. So we were very happy with the turnout, and we think we can do these once a month at various campuses and hopefully raise, in the long term, a couple $1,000s a year through these programs. And this is what I was alluding to was with the boards. And this has really attracted a lot of support from young people Someone mentioned, the programming is what attracts them, and I see a lot of that with Shot at Life. And here's my contribution. And we've been collecting these photos. Everyone knows an avid photographer. I've seen some of you here today. We have about 400 of these photos right now. Our goal is to get a couple thousand eventually and make an art project out of them. We've been talking with some of the creative art campaigns across various Iowa cities and having them turned into public art, highlighting this campaign, really making a lasting impression to a good number of people. But the great thing is it's cost us next to nothing to do this. The boards, we have a couple boards, I think $20. We had some student interns make the signage, and we set out volunteer photographers out. And again, this goes to the advocacy, getting the word out first, and educational awareness. And finally, identifying community partners. As you mentioned, Rotary Club. I've been talking with some Rotary clubs across Iowa. They're part of this big polio and measles campaign right now. They're very interested, so I suggest if you like to take up Shot at Life, reach out to your local Rotary. We've worked with the Boys and Girls Club, and that's a different event where you're getting more, if you're looking for more programs with youth, that's a great outlet. We've talked earlier about college faculty and departments, especially global health studies programs, and student orgs. One of the things we're going to do this fall at Iowa is there's a student org supporting the Gavi Alliance, and we're going to have a flash mob, try to get that in the local news and spread awareness that way. And one last thing I want to touch on is thinking in terms of what if your chapter didn't have those sort of resources. I don't know how many people here are familiar with service learning, but this touches on what we were talking about earlier about getting youth engaged. This is a different approach. Service learning is basically civic engagement programs for students on campuses. Really all you need to be is a registered nonprofit to register with these programs. And it's a gateway onto campus where you might have some difficulty otherwise. I recommend www.compact.org. This is Campus Compact. They are the state offices that help all the colleges within your state with their civic engagement campaigns. And the great thing about service learning is, unlike an internship, they have a faculty member, a teacher usually, who is managing their project. You put in your input, but they do the work. For example, you could even find service learning projects for nonprofit management classes. We've had students try to help build chapters, help recruit members. It's a great resource that I really recommend. I believe the Compact is in about 40 states. And I would really look into that. And Shot at Life is one that we're working on that is going to be especially helpful for us moving forward through service learning projects. And just one last note here. I know Debbie and Caroline have these great resources, but as with any campaign, you only have so many items you can give out. So we've created some brochures. This is a screenshot of half of it. And if you'd like a template for your chapter, we can send you that. Just email me at the address shown there. And if you're not too computer savvy, we can even put your contact information in there for you and then send you the file. And we have this for other UN Foundation programs as well, like Nothing But Nets and other UN campaigns like the UNICEF TAP project. And finally, I just wanted to close with a video just kind of highlighting what I've touched on and showing how we're promoting this campaign in Iowa.
This year, 1.7 million children will die from diseases that are preventable through vaccinations. Pneumonia and diarrhea are the two biggest killers of children under 5, and diseases like polio and measles have yet to be eradicated. Shot at Life is a brand new campaign of the UN Foundation that aims to help children have a shot at a healthy life by providing life-saving immunizations.
The Iowa United Nations Association is a nonprofit organization that seeks to advance the humanitarian campaigns of the United Nations. Shot at Life presents us with a chance to engage students and community members about childhood preventable diseases.
This spring, we held a Shot at Life dinner party, and it was a lot of fun. We had the chance to provide education about vaccines to our friends at the University of Iowa while taking shots of food. And we ended up raising enough money to provide over 20 children with vaccinations against measles and polio.
Iowa UNA has also partnered with Central College in Pella, Iowa, and the Boys and Girls Club of Des Moines, highlighting some of the advocacy campaigns of Shot at Life. Working with the students has been really fun because they really come up with creative ways to promote the campaign to their respective communities. We're so close to eliminating polio and measles, and I know with the help of Iowans and people around the world that we will finish the job.
Thank you.
So I think we want to open it up to questions, if anyone has any. I know that many of you will probably want to take a look at the toolkits, and please feel free to do so. You can contact me, and I think my email address was up there. It's dthomas@unfoundation.org if you want any more information, or Caroline Barrett is also here to answer any questions. I think there's a...
If an individual or a chapter wanted to donate or raise, let's say, $1,000, where would that $1,000 go? What would happen after we send it into you?
Sure. So we are actually taking the funds raised and dividing it equally between the 4 diseases. So it would be a half of the funds would go to Gavi because they're supporting pneumococcal and rotavirus and delivering the vaccines, and a quarter would go to polio, a quarter to measles. So the 4 diseases. There's 13% overhead cost.
At UNF?
That's correct.
And then are there more administrative costs
No.
to those groups?
No.
So I was trying to get the same thing, to follow the money. The money goes directly to the UNF, and then it goes out to somebody else?
Correct.
And some UN agency, or?
Yes, so it's going to UNICEF, the World Health Organization, those are the 2 UN agencies, and then to Gavi. And Gavi is really behind introducing the 2 new vaccines.
What does Gavi stand for?
The Global Alliance for Vaccines and Immunizations. This
Okay,
was actually started a little over 20 years ago, and the idea behind Gavi was to create innovative financing for vaccines. So what it does is it reduces the cost of the vaccines by negotiating with the pharmaceuticals. It gets those vaccines to WHO and UNICEF and makes sure that ministers of health and ministries of finance are jointly involved in the funding.
Thank you.
I guess my question was pretty similar to these two. If the goal of Shot at Life is to raise funds, is there like any way to effectively measure that, since you mentioned earlier the problem is still access?
Sure. So we do report back from all of our UN agencies, so we're actually able to monitor pretty quickly how many children are vaccinated with the funds that we're able to provide. Vaccines, sort of similar to a lot of other public health interventions, need to be sustainable because we have new birth cohorts coming in every year. If you don't vaccinate a new cohort against a particular disease, that disease can come back. So it's never a situation where, oh, we finished eradicating 1,000 kids, we're done. There will always be a need to make sure that these children are receiving these vaccines. So our idea is we receive the reports from UNICEF, WHO, and Gavi, and we're able to trace the regions, we're able to trace the number of children, and we're able to trace the disease.
Okay, so it's being monitored.
That's correct.
Yeah, 2 questions. I loved your map. Well, I loved the presentation.
Thank you.
I saw the map. We love it to see you're all over the country, but how do we know long in advance that you're coming so that we can, number one, have enough people to learn and be inspired by the presentation, also make contacts with the people who are coming to the event, and also to make sure that people know that there's a UNA that is the local partner with you?
Sure.
That's the first question. The second one is many of us are already working on preventable childhood deaths in the Nothing But Nets campaign, both in the foundation. What do you recommend to us so that we can maybe push the whole theme of preventable childhood deaths? And do you have any partnerships when you go to cities or when you want to work with chapters?
Sure, great questions, thank you. The first question as to how you would know that we're coming to your area. So the map that you saw were individual champion events that happened. We physically were not present as a UN Foundation. The champions were doing the events themselves. And what we're actually attempting to do is we reach out to these champions fairly frequently, about once every 2 months, with a webinar. And our idea in an upcoming webinar is to share information on UNA chapters with the champions so that they know, they've been told in the past to come to us if they're hosting an event so that the UNA chapter can be involved, but this will be our way to actually reach out to them and to have a representative from UNA USA on the call to reach out and tell them that these are the folks in your community that you should be inviting to these events. The other thing about champion events that we've noticed is a lot of the times they're hosted in their own homes or with their own children as part of a child's birthday party. So it tends to be a very sort of personal event. But to your other question about when we are heading to these cities, we're going on the road. We actually are starting our very first public city tour, if you call it that, and we're heading to Charlotte next week. So we're pretty excited, and we have a full map of where we're going to be in 2012 that we're going to share with all of you in a follow-up. And then your second question on Nothing But Nets. What a great synergy, right? We've got shots and we've got nets. So as you can imagine, for those folks that have taken both campaigns and decided to embrace them both, they have talked about the childhood mortality, MDG, of course, and they've also used that great message of 5th birthday because, as you know, deaths due to measles are also predominantly before a child turns 5. But what they've really done is taken the sports piece of this and run with it. We had a great organization, a group of pharmaceutical students actually, or pharmacy students actually, do a shot party where they did a basketball type call to action, and they did it for both Nothing But Nuts and Shot at Life. So there's some great combined resources there as well. And of course, when we do go on the road as UN Foundation, we do represent all of our campaigns. Great. Well, I just want to thank everyone for coming. I want to thank Yasser specifically. And I just want to say that we have a lot that we can learn from all of you as nonprofit leaders, as community managers, and as folks that are out there talking to people. If there's something we're not doing, we'd love to hear that. That's really our biggest learning and our opportunity to take this campaign and make it go. So thank you for your support.